I guess it helps if I unmute myself. Um, how about if you go ahead and just start and I'll be here to monitor everything and make sure it's recorded, unless you'd like me to do an intro.
No, I'm good with it. So let me go ahead and try to share my screen. Um, let's try this again. Sorry, guys, I've had serious technology problems. So my computer just whacked out on me. So let me try this one more time. So I think it should work this time. And Amy, if you'd let me know, that'd be awesome. Can you see my PowerPoint?
Yes.
Oh, I'm off to a good start here. And we're doing from slideshow.
Yep.
Okay, great. And I have limited because of I'm at home and on my laptop, I have very limited access to chats and other people. So flag me if somebody has a question or anything like that. I'd really appreciate it, Amy.
All right.
Sounds good. Thank you. Hey, welcome everyone. My name is Keith Meyer. There's a nice introduction to me on the invite that you had through Teams. Just a quick overview of who I am. I'm the director of counseling and wellness. Most of my professional career, I've been in the private sector, had my own practice, consultation, been teaching at universities and things of that nature. I specialize in the area of trauma probably the last 20 years or so. And I don't know, I watch people's homes while they go on vacation. Enough about me. I just a little bit of background. If you want more information about me, just ask. So a couple of things about today's presentation is number one, your thoughts and questions are more than welcome. Matter of fact, you're more important to me than me getting through my slides. I'd rather talk to you. Also, would really encourage your participation on whatever level you're comfortable with. You can just ask a question out loud. You can send something in the chat. And because, just listening for the next hour, I'm just not that interesting of a guy. So your interactions, we also learn from each other, right? So that's really good. Also, for you introverts, I promise you I will not do a breakout room. My heart goes out to you. I'm more introverted than extroverted. So I've done hundreds of trainings. Probably the first 150 of them, I felt like I was going to throw up each and every time in the beginning. So hearts go out to you. It's an hour long. We won't do a breakout session. Okay, so we're going to do just an overview. We're going to learn about psychological distress, information on PTSD. We're going to take a neuroscience approach to understanding trauma. So we're going to learn about the amygdala, hippocampus, sympathetic nervous system, parasympathetic nervous system, the neocortex, insula, hippocampus, we already did that one, cingulate cortex, the integration of brain change approach. I hope you find this interesting. The painful part about doing it like a 3-hour or 4-hour presentation into an hour is it's what I leave out. So I have to focus mainly on adults, but wherever I can, I'm going to slide in information about children and trauma as well. So just to begin with, we're going to talk about trauma in general. And remember, these are just general statements. There's going to be many exceptions to that. Just we want to understand that we're all different. So we all deal with trauma in a different way. Men overall experience trauma at just a slightly higher rate than women. However, women are more likely to have psychological complications from trauma because their trauma has tendency to be more personal in nature, chronic, and severe in nature. Also, just so you know, in the United States, I think this number's low, but here's what's being reported by the PTSD National Center, is about 50% of all Americans who experience one trauma event in their life. If you happen to be fortunate enough to live over 65 years old, that number jumps to 75%. Childhood trauma, wow, the research is all over the map. It goes from 14% to 43% of the population has experienced trauma. Here's one of the things that we don't know why, but what we do know is if you happen to have trauma in your childhood, you're more likely than the general population to have more trauma as an adult. So let's just start off with some interactions. What are different types of traumas? What What would you, excuse me, I think I almost fell over. What are different types of traumas that exist in the world or in the United States? What are different trauma events? Like we have natural disasters. What are some other ones? Amy, are we getting anything in the chats? You're muted.
Yes, we just started. So several good suggestions. The pandemic, war, being victims of abuse, combat, generational trauma, domestic violence, poverty is trauma, car accidents, lots of great suggestions.
Wow, that's wonderful. So just so you know, a couple of those things, car accidents, just so you know, in my field is the least likely, if I can spit this out, least likely event to be assessed, even if you're seeing a mental health therapist. So I'm glad somebody mentioned that. Also, just so you know, the number one trauma event most likely to lead to the development of PTSD is sexual assault. Just for your information, the most underreported crime in the United States is sexual assault. It's so frustrating, even with search engines. If you just put in underreported crimes, it won't even pull up sexual assault. You have to actually ask a search engine a direct question about that. So now, yeah, we got a different sense of trauma events. Now, what we want to understand when somebody experiences trauma, they're going to go through, from a psychological point of view, psychological distress. Okay, what does that mean? How does trauma impact our emotions? How does trauma impact us mentally? How does trauma impact behaviorally and also physically? And how do we move from trauma and psychological distress to the possibility of development of PTSD? So let's just go through this real quickly with each other. I threw a couple of examples out so they can get us going with participation. One example is like, how does trauma affect someone emotionally? Well, they can become detached or hopeless. What other emotions are around trauma? What other feelings can people have? Emotions.
Anger from the
Anger, yeah,
chat,
rage. Very good. What are some other ones?
helplessness,
What's that?
helplessness,
Helplessness,
helpless,
really good.
yes. Fear of
Good.
crowds, hypervigilant, sadness, fear in general, numbness, hypervigilant.
Yes, no, very good, excellent. And
Yes.
how can somebody be impacted mentally? Like I threw out confusions, maybe having obsessive thoughts about what happened, maybe struggling with making decisions. Does somebody else want to add, how can somebody be impacted mentally?
I see it. Someone said not enough, and I'm thinking maybe, they feel that they're not enough, that because they're affected by it, we overreact, become unfocused, act out sometimes.
Yeah, and we're also moving into some in the behavior category, acting out, isolation, more argumentative. And just so you know, it's very common to have increased drug and alcohol use. And just, I want to cover the last one, physical, heart racing, nausea. How does somebody get impacted physically? What are some other examples of somebody being impacted with their body? Because that's what we're going to emphasize today, our brains and our nervous system.
Someone said depersonalize, which I highly relate to. Depersonalization is a big effect. Stomach issues, pain, reliving the trauma, insomnia, eating too much or not eating enough, fatigue,
So,
headaches.
excellent. And Amy, thank you. This is very helpful to me. I really appreciate your support with this. So depersonalization, just so you know, that's a form of disconnecting. So we can disconnect from our bodies and we can disconnect from our surroundings. So when we think of depersonalization, we're thinking of disconnecting in some way from our body or our environment. And it could be just, everything's familiar, but it can feel off in some way. You can feel parts of your body physically, but not other parts. If things can feel strange and unusual, and yet in your head, this isn't like some sort of like psychotic break. So I just want to make sure you knew what that meant. A disconnection from your body and your surroundings is what most people try to use that for. Now, when we have psychological distress and the psychological and physiological impacts of trauma last for over a month, and impact us in a significant way. Work, school, friends, connection to our community, problem solving. Now we're moving from psychological distress to possibly the development of PTSD. Just so you know, most people with trauma, most people looking around 70%, 75% of the time will move through the psychological distress to the point where they won't develop PTSD. But if it continues on and it continues to be intense, we start to look at the development of PTSD. So just what is PTSD? It is a mental health condition resulting from experienced trauma events. This mental health condition impacts a person mentally, emotionally, physically, and possibly, and it should have been behaviorally in there, my mistake, and possibly spiritually. At some point, if we have time, I'll talk a little bit more about moral injury. This condition impacts functioning, work, school, community relationships. Really important to understand this. This has nothing to do with intelligence, talent, skill set, or willpower. I'm going to spend the least amount of time on this. This is just for your awareness. In Psychobabble land, we have a thing called Diagnostic Manual 5TR. It's been a revision of it. There are some real advantages to having a diagnostic manual, and there are real disadvantages of having it. So just so you know, they define PTSD is that you have to have a direct or indirect experience with a trauma event that's life-threatening or a sexual assault nature. I don't agree with this total definition. I think it's very limiting, and I think it just encapsulate what it should. But they do acknowledge some like vicarious trauma that can happen with first responders and things of that nature. So the first part of it, when we look at the categories and how symptoms cluster, the first one is just kind of recurrent, intrusive things around like flashbacks and nightmares. The second one is, which is very, I want to just really say this, is very, very normal. People want to avoid things that remind them of a painful event. That's just very, very normal. And the third one is we begin to see some negative changes in the way we think about ourselves, the world, and our mood, and they're very deep-seated with like feelings of fear and shame and guilt. And then that arousal part, being on guard, irritability, difficulties with sleep, trouble concentrating, so on and so forth. If you remember one thing from this presentation, please remember this. Psychological distress is a normal reaction to a very abnormal event. So when we think about it, we want to understand that when people go through this, this is not abnormal. And whether they're more impacted emotionally versus behaviorally or things of that nature. But if you think about it, if I go through a really hard time, a really stressful event or traumatic event, and I just go, oh, well, no big deal. You know, there's something off with that. So we just want to just really understand this compassionately as we move forward. Give you a couple examples of symptoms so that we understand PTSD in a different way. For example, nightmares versus night terrors. Most people have experienced nightmares. Nightmares is an awful dream where we wake up and we realize it was an awful dream and we're glad it really didn't happen. Most people can relate to that. People with PTSD can have something called night terrors, which is different than nightmares. So not to get too lost in the weeds, is in our brain, we have alpha receptors and beta receptors, and alpha waves and beta waves. What happens with a night terror is certain beta receptors and alpha receptors become activated. Okay, what does that mean? What that means is your body's going to react to the night terror as if it's happening in conscious aware state. So you have screaming, yelling, thrashing, movements throughout the house for some people. And what is really important to understand, they're reacting to the dream. So it's not a sleepwalking situation. They're reacting physically to the dream. The other thing that's really important to understand is when somebody wakes up from a night terror, because these receptors are activated, there's no transition from sleep to wake. So what that means is the night terror can keep going while they're waking up. So what happens is people can see things, hear things, smell things, taste things, and sure as heck feel them after the night terror is over. And they can remember the night terror very vividly for the next day or the following couple of days. With a night terror, we want to do complete opposite of sleep hygiene. What I mean by that is we want people to fully wake up, engage their five senses, splash water on their face. They want to really shake off the night terror before going back to sleep, because with night terrors, it's very easy to go back into the night terror as you go back to sleep. Unfortunately, night terrors are so terrifying, people often don't want to go back to sleep. But we want to at least people take 15, 20 minutes to shake it off before they try to go back to sleep. So that's an example of one symptom around trauma that we recognize that can be very different than the general population. The other one is hypervigilance. So it's easy to think of hypervigilance as I'm going to track everything that's going on in my surroundings, possible threats, and all these contingency plans. It's really important we want to understand this is incredible cognitive engagement. It takes incredible amount of mental effort to do this. The simple fact of going with a loved one to a restaurant and sitting down and tracking everything that's going on around you, as well as the conversation you're trying to have with that loved one, results in incredible mental effort. So with hypervigilance, it's very common for people to miss information that's going one-to-one because they're focused on their environment. It's also important to understand at the end of the day, there's and I say this compassionately, a mental fatigue that comes with it, where you become mentally exhausted because you are putting so much conscious effort and focus into being aware of your surroundings. Couple examples of PTSD symptoms. General information about PTSD. The rate of PTSD in the United States a little varies depending on what you look at. It ranges from 5 to 8%. Really important that you understand, with PTSD can come other mental health conditions that are important that you get support for. So for example, in my field, we call it major depressive disorder. It's an episode of depression. It's a severe depression that goes beyond sadness. That people who never experienced a major depressive episode, after being diagnosed with PTSD, 48% experience a major depressive episode. We also want to understand trauma. When it develops in PTSD, it may not be the one event, and often it's not, but it might be the 6 events that came together. That it's not uncommon to have what we call an accumulation effect, the impact of stressful events with trauma, things of that nature. It is very common that self-medicate with trauma. Increased use of drug and alcohol, depending on the research, with somebody who, after trauma and developing PTSD, could be 48 to 60%, depending on the research that you want. We already mentioned this, most likely not be assessed or car accidents, so I'm glad somebody mentioned that earlier in the chat. Just a little information on diversity, equity, inclusions. Highest rates of PTSD are among Indigenous people, African Americans, the lowest around Asian Americans. With the LGBTQIA community, 9% that identify themselves as men, 20% that's identified as women. Really important that you understand that's twice as high as the general population. Also, what we want to understand, as well as Indigenous people or people that are transgender, experience much higher rates of trauma. It's just every higher rates of unemployment, less access to what they need to recover. And it's just important that we understand the impact that it has on diversity and equity and inclusion. Just so you know, with gender, 10 to 12% among women for PTSD rates, 4 to 5% among men. Just so we want to understand, it's not only an increase of PTSD and trauma, but also the ability to access resources they need to recover. So it comes both ways. So now we're going to move in from PTSD to understanding, information about PTSD, but to understanding how does trauma affect our brain and our nervous system. Now, when I go into this, I don't want you to get hung up on terminologies. What we just want to do is understand this conceptually, and most importantly, what we can do to make things better. So the first thing, there's a expert in the field on understanding the neuroscience of the brain, Dr. van der Kolk. So this is a statement that came from him from his book, Body Keeps the Score. Trauma tends to get fragmented, compartmentalized, stored in different parts of our brain. This is why it can take so long for any trauma survivor to make sense of what they have been through. The sights, sounds, physical sensation, emotions associated with trauma can be cut off from our more rational parts of our brain. This is why it's so important to treat trauma on the level of the mind and body, because it's the only way to begin to create a cohesive narrative and heal. And Amy, I just want to check real quick, does anyone have any questions or comments in the chat?
So there's been a few good comments lately about night terrors and how difficult it is for someone to, sleep next to them, how that could be for their partner to be very scary. And then other good comments about, traumatic events, how that relates to, alcohol use
Perfect. Thank you, Amy.
and
Yeah,
triggers.
Yeah, absolutely. So it's important that when we have somebody who develops PTSD, that now we're impacting relationships, family, close relationships, and the fallout. What happens with those impacted? They often don't get the support and acknowledgement that they need, because we're trying to figure out how to help people with PTSD, and they're struggling to get the support and resources they need, and then we don't effectively help others that are trying to support them and care for them. So when we look into the neuroscience of trauma in the brain, what we want to understand is when we go through having our flight or fight response activated, our body goes through remarkable changes. So, just basically what happens is the amygdala is our smoke detector. It allows us to understand when we are being threatened and what's going on. This is also a system that's in place to actually preserve us as a species, as the human race. This is how we try to survive threats. And it's a system that every human being has. And when it's activated, we'll talk about what happens to our mind and our body. So basically, when we look at understanding when our sympathetic nervous system is activated, our flight or fight response, our body goes through remarkable changes in a really short period of time. First of all, our five senses heighten. Give you examples: our eyes dilate to expand our vision. Our heart rate increases, our breathing increases, it becomes more shallow. Our blood pressure increases. Major muscle groupings begin to tighten. Energy is being diverted from unnecessary systems like reproduction and digestion, and including immune system. That's why when we have long-term stress and the system is constantly activated, we're moving energy away from our immune system, including our anti-inflammatory system. That's why when we get stressed, we have a tendency to get sick more often or more severely. It's also why we have chronic pain. Our anti-inflammatory system isn't kicking in. So the other thing that goes along with this system kicking in is something called our hippocampus. And we're going to go through each one of these one by one. Starts to produce what we call cortisol. Cortisol makes it so that we're less likely to experience pain. Adrenaline gives us incredible rush and energy. Cortisol is the one that makes us not feel pain when we're trying to survive a trauma event. Just so you know, liver's pumping out glucose so it can be turned into energy. That's why with long-term stress, people can develop type 2 diabetes, because the body can't process it right over time. Fat is turning into energy. Just in the essence with this system, given your health and your age, you're as fast and as strong as you possibly can be given that moment. The goal is to survive the threat, right? That's the goal of this system. So what happens when this system turns on, it's really important we understand what this means. There's no sense of consequences. There's no sense of time. Not that you're going to go against your values. What that means is all that exists is this moment and surviving this moment. So if I'm, for example, I use a silly analogy. Let's say a bear is chasing me, right? So I'm running, I'm coming up to a ditch. The last thing we want to do is engage my analytical mind. So what I mean by that is the last thing I want to do is, oh, wow, that's a big ditch. I don't know if I'm going to make it. We just jump. We just do it. I don't want to be thinking about 5 minutes from now. I want to be thinking about all that exists is this moment. And the system's meant for this. So just so you know, our executive functioning, the higher parts of our brain, the things that we engage 90% of the time, maybe 95% of the time, is problem solving, organizing, prioritizing, solving problems, so on and so forth. When the amygdala is at heightened full blast, we lose access to that part of the brain. That's why with people with severe anxiety may even struggle to carry on a conversation, listen to instruction. It's because the system is saying there's a tiger in the room, even though there may not be a tiger room, or you're just sitting in your living room. This system's reacting as if this serious life-threatening event is occurring. And so the system is instinctual in nature, reflexive in nature, not analytical in nature. The reason why we're not engaging our analytical executive function is to give us the best chance to survive, just to react to whatever we need to give us a chance to survive the moment. Now, what runs this, or what exists in this system, in an area of the brain called the limbic system. The limbic system does a whole bunch of things, but runs the sympathetic nervous system and something called the parasympathetic nervous system. If for whatever reasons the amygdala or that part of the brain says flight or fight won't work, then you move into what's called tonic immobility to try to survive that moment. In other words, our freeze response. You go into a very submissive state. You don't talk, you just observe, you don't move. You're less likely to feel pain in that moment, and time is experienced as slower. Just so, again, cannot emphasize this enough. This has nothing to do with willpower, your intelligence, skill set. This is an instinctual thing that will occur. For example, 75% of people, children who experienced, 88% of children who experienced sexual assault reported some sort of tonic immobility. 75% of people who experience sexual assault as adults reported some sort of tonic immobility. Before I move on, I just want to make sure, does anyone have any questions about this part?
So we have a lot to catch up on in the chat. I was gonna have you pause here so we could try to catch up as well. It's a good time for that.
Okay.
There was some good mention about, different presentations people have as their reactions, how overeating and eating disorders can also be related to trauma, and how fight, flight, or freeze, tonic immobility. A lot of people seem familiar with that. And a previous training that had suggested if you have PTSD to wait 6 seconds before responding. I like that suggestion. Take a moment to think. A good comment about how diabetes and the blood sugar, how some of our health conditions can be related to that, the blood sugar increases that happen from the constant stress reaction. And then complex PTSD is something that was a good suggestion someone wanted to talk about, and how little things can add up instead of one big event can still be just as damaging to your life.
Yeah, so what I'd like to do is, if it's okay with the complex PTSD, we're going to have a section of understanding PTSD triggers. And we want to understand that there's associations with the trauma event that we make while we're experiencing the trauma itself, or people are. And it may sound like a simple, small thing, suddenly can result in a huge internal inside you experience that is overwhelming and awful in nature. So when I go through the PTSD triggers and that doesn't get the answer, whoever wrote that, please flag me and I'll follow up on anything that you need. Great comments, love your participation, and we'll just keep going. So we're going to take a little deeper dive into this, right? A little deeper dive is the amygdala. The amygdala is constantly working through our five senses to understand threats and understand what we can do to survive those threats. When it learns some information, it works closely with the hippocampus to develop memory around that, so we can easily access that in the future. So the amygdala, again, the impact on the executive functioning is that blood literally moves from this part of the brain to the limbic system. So we just have less access to our prefrontal cortex. Amygdala and trauma, just so you know, with trauma events, the amygdala can enlarge. And when it enlarges, what does that mean? Is smaller events can be reacted to as if there's a tiger in the room, when in the past it didn't do that. Just slide in one thing about kids. If a kid goes through severe neglect, the amygdala does the opposite. It becomes smaller. And so what you have is kids or possibly adults that result from neglect underreacting to a crisis situation and being confused why people are upset for not taking some sort of action in some sort of stressful event. So when we take this approach and we look at treatment, what we want to understand is how this affects us. We can't be consciously aware when our amygdala turns on, but we can see the effects and experience the effects soon after it turns on, even within seconds. So the treatment that we begin to set up for understanding this way of managing trauma is we begin to understand how the amygdala affects us, and we begin to learn when it turns on, recognize it, and learn ways how to turn things off. Understanding the hippocampus. Now, when I was talking about before, the hippocampus, when it becomes activated with trauma and our flight and fight response, it turns to pump our cortisol. Again, for us to experience as little pain as possible so we could try to survive that event. Well, hippocampus does a number of things, but one of the things that it does normally for us is turn our experiences into memories. And just as important when it comes to trauma, it's really important we understand this, is that it also timestamps our memory so that I understand when I'm thinking of a Christmas when I'm 10, that was the past. Because it flips to cortisol, pumping out cortisol, memories are often not integrated. So we may have memories of things, but it's not going to follow a normal sequence because it hasn't been integrated all the way through the process. That's why in theory, it often doesn't happen. Somebody experiences sexual assault, for example, and they report it to the police. We have somebody with the training to know when they go to interview that person, you don't ask what happened at 5:05, 5:06, because that sequencing is often not there. You just start where the person's at and start asking questions. Okay, what do you remember seeing? What do you remember hearing, smelling, things of that nature? Also, this is why eyewitness testimony can be unreliable in the sense of like sequencing. And so that's why, because this part of the brain, for lack of a better word, goes offline to do something else. I was going to give an example for you, but we're running a little bit out of time, but you get the idea. The hippocampus and trauma triggers, because these memories aren't integrated and often compartmentalized so it doesn't overwhelm us. The amygdala relies heavily on the hippocampus with certain inputs from our five senses to help us understand, okay, are we safe or are we not safe? That's why suddenly a backfire from a car, the body begins to react as if that's a gunshot. It's because that memory hasn't been integrated, hasn't been properly time-stamped, and then there can be associations that with certain sounds, smells, sights, and things of that nature that can be overwhelming for somebody that experienced PTSD that comes from the hippocampus. So the treatment is, when we take this approach, the treatment is to have productive processing of trauma so that these memories can be integrated and also properly timestamped. The insula, this is an important part of understanding what happens to us with trauma, and more importantly, how do we recover from trauma? Insula is an interesting part of our brain. If we were in person, I wouldn't be standing behind a podium. I'd walk around just the room, talk to from different points of view. What the insula does is not only give us balance, but gives us great spatial relations. So I don't keep running into chairs, keep running into things. It does this automatically for us. So it does this without our conscious effort. So as soon as I'm moving around the room, I'm not running into people, tables, and things of that nature. That's our insula in action. In regards to trauma, insula is the part of the brain that allows us to have self-awareness of our internal world, from our physical needs to our emotional needs to our thoughts. It allows us to register with that. What happens with trauma is we could be underreactive and overreactive with our insula. A little bit of anxiety can suddenly feel like panic because that's what we experienced around the trauma. We started with anxiety and it grew, or in the aftermath of trauma. Underreacting is when we disconnect, detach, become numb, maybe even depersonalize. And so what we're trying to do with the treatment is give a lot of information about what happens to our body, differentiate between the here and now and trauma, so we can have that awareness. Oh, I'm starting to react to my trauma, not what's going on here. And then when we start to do that, that awareness kicks in, we can intervene earlier. We already talked about the prefrontal cortex. We don't really need to cover that. Just remember, it's a higher executive function of our brain. And when trauma happens, we start to lose access to it. So you go like cortex, this is our self-regulation. This is how we have feelings and emotions and how we regulate them and move through them. And what happens with trauma in a cingulate cortex is we can struggle with regulating our emotions for a situation where we know we're okay, but it feels again like there's a tiger in the room, and we can struggle with this. With just to slide something in with children, teenagers that experience physical abuse and sexual abuse, this part of the brain is overreactive. So for example, they may see threats in situations where threats didn't exist. What we do with treatment from this approach is we learn very specific things, how to regulate our feelings and our thoughts. Okay, before I jump in this section, Amy, I just want to catch up and see if there's anyone has a question or anything of that nature. Oh, I'm sorry, Amy, you're muted.
Oh, yep, car alarm was going off a moment ago.
Oh.
So just a little bit of discussion in the chat about fireworks and how hard that is for some vets and dogs and people. A few good suggestions. I know for me, I put fireworks on the TV or music, but something that so the dogs can't always tell where the sound is coming from. It blends in.
No, that's a really good point. So let's, 4th of July, we're honoring the existence of country, which means we're in some ways honoring veterans. And then it makes sounds and sights and smells that are just kind of tormenting in nature. It makes no sense whatsoever. So here in Tumwater, they actually banned it for one of the reasons was that. Also the fire, also the torment to animals. I just, what I find with people's approaches is find the thing that works for you that's practically. I know of veterans that literally get away from the area. I know of veterans that they're able to muffle the noise. The problem is the hypervigilance. Okay, if I'm muffling noise, I don't hear bad things coming. So it's a little bit of a balance that way of trying to find the right thing that works for you. With my small dogs, I literally have to medicate them. The last couple of 4th of July's has been better, but finding that plan that works for you, and just doing practical things. Again, love the comments, love it. So thank you. It makes everything more interesting. I appreciate that. So now we're going to do, okay, we've talked about this. We dove into some of the neuroscience behind trauma and begin to understand our nervous systems and our brains. And okay, what are we going to do about it? How do we make this better? So the first thing that we need to understand is neuroplasticity. What that just simply means is, what do we got? 86 brain cells in our brain, 86 billion, excuse me, brain cells in our brain. What that means is our brain can change. With the right support, the right conscious effort, we can change, and we can change our nervous system. So one of the things that we want to understand is the nature of anxiety and the nature of what can be overwhelming. So I'm going to just use anxiety as an example. Let's just do a simple scale. 0 means I am on some beach somewhere in the world and I feel fantastic. I don't have a worry or care. I feel completely safe. 10 is a full-blown panic attack. I feel completely terrorized. What we have to understand with the nature of anxiety, there's a number along that scale. Let's say I'll pick on myself. Let's say it's 6 for me. If what I mean by this is if I start to experience anxiety higher than 6, I no longer can think my way through this. The reason why is the nature of anxiety. When I go to think, all I come up with incredibly anxious thoughts. So what we have to do is use our body during those times to make those changes, those positive changes in our brain. Those are called bottom-up approaches. Once I move down past the 6 and move to the 5 and 4, I can engage my mind now to help me work the rest of the way through whatever that anxiety or trigger may be. So bottom up approaches, just so you know, they're rhythmic. Like one example is rhythmic movement, walking, Tai Chi, yoga pose, walking slowly, throwing a ball, but doing it in some rhythmic thing that allows the elliptic system to engage the parasympathetic nervous system, sensory grounding, noticing everything around you, uh, uh, active muscle relaxation, where we tighten our muscles, hold it, then we let go of it. Deep diaphragm breathing. If you deep diaphragm breathing, just hook your hands behind your back, start breathing, it starts to push your air all the way down to your diaphragm. Within 3 or 4 breaths, you're synchronizing your heart and lungs together, which means you're engaging your parasympathetic nervous system. So what we want to do is understand that when we need to, we don't go through thinking, we use our body first and then engage our mind. Top-down approaches, unfortunately, in psychobabble land, we have a tendency to make this about like prolonged exposure therapy, cognitive reprocessing. All this means is we're going to engage our mind to help think our way through what we need to do so that we can feel better and improve. So even self-talk, that's top-down engagement. Just so when you go to look up, like if you want to, hey, what are top-down approaches, get through the psychology of it all, and it'll get to the specifics of, ways to approach things successfully. I just want to make sure on this page, Amy, do we have any comments on this?
No.
Okay, cool. Okay, so now we're trying to pull everything together. When we take this approach and you're working with someone in this way, the first thing that we want to understand is there's an incredible amount of education. We don't just drop into it processing the trauma, because we have to do it productively. The last thing we want to do is start processing the trauma, which results in flashbacks, which results in nightmares, results in all kinds of painful experience. So the education is understanding trauma and trauma reactions, identifying your body and what happens to that. What are we going to do for bottom-up approaches? What are we going to do for top-down approaches? And what are we going to do to process this in a productive way? So the incredible amount of effort put into education and information gathering. Once we do that, we're going to start moving into processing trauma one step at a time. So the first thing that we do is we establish what we call a free zone. Now we're scaling from 0 to 100. So some free zone is where is that those numbers where if I'm in between those numbers, I can productively talk about the trauma in a way that where I'm moving forward or moving through it one step at a time. So just remember, when we scale that, when we initially start working in processing trauma, that number is that range, for better terms, is usually pretty small. So typically you're going to see somebody between 30 and 60. So anyone in that range, I can talk about the trauma in some productive ways or aspects of the trauma. Now, remember, processing trauma can be the event and the impact, or more the impact than the event itself. That's still a really healthy way to process trauma. So also keep in mind when we talk about scaling this, if somebody's experienced trauma and has PTSD, they're never going to be at a 0. Because if you go, like I use the example of 30 to 60, if you start to go into like 20s, what happens with people who experience trauma, they begin to panic because they feel like they let their guard down. So we're finding a number where my guard's up, but I don't feel overwhelmed by anything. What happens is when we begin to do this, let's say somebody starts talking about the trauma and I start saying, okay, what number are you at? They're at 58. I'm going to stop talking about the trauma and engage those bottom-up approaches and those top-down approaches, so they move back to around 45. So it's not a constant flow. What we find research-wise, if we do this and do it correctly, that range starts to open up fairly quickly. We start to move from 20 to 70, 20 to 80, where people are more freely able to talk about it and move from dysregulation back into regulation, We do this through titration, and we start to pull everything together. So what do we have going on? We have the insula that's now becoming so much more aware of our internal state. So we can intervene earlier, begin to recognize things right away. We are aware of it. We implement things. We find things that are successful, and we begin to manage things very successfully. The hippocampus, what is going on with that? Now, because we're productive and we're moving through it, we are now integrating those experiences into memories, and just as important, we are time stamping those memories. As we understand the amygdala, and how it impacts us, we're able to manage the system, not the person. So we're not talking about a character flaw. We're managing a system successfully. And then we begin to singulate cortex. We begin to be able to self-regulate ourselves better around trauma. And then we are able to engage the executive functioning of our brain, all the wisdom we've gained through the years, the skill sets, the thought process, the problem solving. We begin to access that on a regular basis. Just checking in on time real quick. I want to make sure before moving on, does Amy, are there any questions or comments?
So I made a comment a moment ago about how music helps me a lot and asked people what helps them feel better. And there was quite a few people that suggested music is very important to them, and certain types of music like heavy metal or bass centric electronic dance music. I can definitely relate. Growing plants, that kind of stuff. A lot of good answers. Kittens can be a great stress reducer.
One music is, and just so you know, that's a bottom-up approach. That you're working through that sound with your body towards your brain, and that's an incredibly. Dance is another one. So if you're mixing up both, that's an incredible thing. It's interesting through the years. What do we do with babies when they're trying to sleep? We rock them. It's just fascinating what we learn now. Mike, did you have a question?
I did. I was wondering what components physical fitness can play in this, because what we saw when I was in law enforcement, when people were going through combat and the heart rate reached over 200 beats per minute, you had the forebrain completely shut off. And we saw a lot of physical fitness kind of help prevent a lot of this stress stuff, but also relieve it on the back end. And so I don't know if there was any scientific data to actually back up how physical fitness can actually play into reducing stress and trauma.
So, Mike, to answer your question, really good point. I think I heard your question. If I didn't, please correct it. So, Mike, to answer your question in general, any condition you have, the more physically fit you are going into that condition, the more likely you're to survive it, and more likely you are to recover from it. And with certain professions, as you know better than I do, you will have extreme pressures on certain systems. One of them is the cardiovascular system, not only with heart beating, but if you took somebody's blood pressure at that time, you could see numbers that would tell you get to the hospital now. Yeah, and so taking care of yourself, not only physically, but also having support, also having connection to your community. What we find with children, when they are taken out of an abusive environment and they have a significant healthy attachment with one adult, connection to their community, you begin to see their brain and nervous system develop normally again. So, Mike, I really appreciate the point. Really good question. Anyone else? Any other comments, Amy? That's there.
There's a good question here asking for suggestions for night terrors.
Okay,
We've been
so
focusing on sleep hygiene so far.
okay, so a couple things. One of the things to be aware of, there is a very effective medication developed by Dr. Murray Raskin called prazosin. And prazosin, depending on the research, about 75% to 80% of the time works very effectively. So you don't stop dreaming, you stop having the night terror. So it's a really important thing. Not a lot of family doctors will know that, but if you bring it up to your family doctor, that's a possibility. So prazosin, just so you know, is really not a very good blood pressure medication. It's a synthetic blood pressure medication. I think it was developed in the 70s. But what it does do is it blocks certain alpha and beta receptors so they don't become activated at night. Night terrors, if you're not with the medication, one of the things that you can do is make sure that you have good sleep hygiene going into it. So what I mean by that is if you're having anxiety or something that's intense, we want to try to work through that or have the support around that before then. Here's the dilemma. There are things that work really well. Certain sounds like ocean sounds. The problem that people with trauma experience is, okay, that means I can't hear what's going on outside. It relaxes me and I'm not thinking. So that's the struggle, is finding those practical things that work. Certain sounds, like, you can put earplugs in, and that can effectively work. Having earplugs, having certain, self-talk. We just have to find the one that works for the individual, because it depends on what part of the trauma they're experiencing with. I hope that answers your question. Shoot, I hope it does.
I think that was a good answer.
Okay, I appreciate it. Thank you, Amy.
Someone just asked about tinnitus. So are you asking if prazosin helps with tinnitus, Amy?
Yeah, just general sleep issues related to tinnitus. So his tinnitus is pretty bad. So he gets migraines and it's hard to sleep, but he doesn't like to take anything because then he feels that hangover in the morning. So
Amy, my heart goes out to. So tinnitus, just so you know, is a ringing in the air. Very common for veterans to develop that, and with PTSD symptoms themselves, the ringings can become very severe. Even without PTSD, tinnitus can be so disruptive to someone's life, sleep habits, things of that nature. What I found is working with other veterans is having sounds that overwhelm the tinnitus, or at least tries to bring it down some with the sounds. And that could be whatever's soothing for the person. The problem with that, again, it may make somebody uncomfortable because they're not hearing their surroundings like they normally will. But if we could find that for that, just so you know, prazosin doesn't help with that, but it would help with the night terrors if that's a contributing factor as well.
yeah,
I hope that answers
yeah,
your question.
I do. I think that's why he slept with the TV on for so long. But then the TV also is kind of the catch-22, because then the TV, he's not getting like really good REM sleep with TV on because he's constantly being awoke, by the noise. So it's kind of a, yeah. I think I'm gonna try this white noise machine that I found. It has really good reviews. So I mean, we sleep with the fan on and things like that, but it's not really enough to really help him sleep.
Amy, that's a great idea. With phones, if he's has any sort of appeal, like the ocean sounds, to streams, to wind, to certain nature sounds, what we find is that's very helpful for getting good sleep as well, if that's helpful to you.
Someone's suggesting 6 hertz binaural beats to help with sleep, and I can vouch for that as well. I use all kinds of different frequencies on YouTube videos to help me sleep.
Perfect. No, that's wonderful. That's exactly finding those things that work for you. So we're basically running out of time. I was going to use an example of, and I won't go through it all, how this approach really helped with Mary. When I first met with Mary, I just said, "Hi, Mary." She did the intake. I had the information. Just what brought you into counseling? And for the next hour and a half, she just cried severely. And no matter what I say, even if I try to interject something, it felt like it startled her. I was so worried about her that are you going to be okay? Do you have a friend to stay with? I mean, I made arrangements to call her later that night, follow up the morning. She's a woman veteran that was sexually assaulted by her fiance and also violently assaulted as well. But what we found is a lot of information about understanding trauma, what happens to your body, understanding certain approaches. She began to get better. And we started off not with the trauma itself. We started off with, like, she didn't like spiders. So we would just like practice these things where she imagined seeing a spider in the corner. And then the spider got closer. The interesting part with Mary, I think it was like session 6. We were just taking this a step at a time. She just came in and said, "Keith, I got to get this off my chest." And she ended up talking about the trauma she went through, and just went on. And I didn't even say a word. I just listened. So for some people, this works really well. Unfortunately, we're getting a little bit on time because, like I said, I'd rather answer your questions and get through all my study. Just an interesting on cerebellum. cerebellum, we used to think was a primitive part of our brain. It was in frogs and lizards, so we didn't pay much attention to it. About 5 years ago, we realized it's actually connected to the higher parts of our brain. So what it does without conscious effort, whatever we're doing, it helps us to improve doing that. So like, for example, if you're playing like a word scramble game and you're making words out of letters and suddenly you start doing that really well, that's your cerebellum in action. GABA study, gamma-aminobutyric acid. In a nutshell, what we found is if people with higher levels of GABA in their hippocampus can block out better than the general population negative thoughts and negative feelings. In other words, they just have to tell themselves, I don't want to think about it. And with higher levels in that part of the brain of GABA in the hippocampus, they're very successful at it. Obviously, there's research on how to do that successfully to help people with PTSD and anxiety and things of that nature. This is the one part I wanted to talk about, the stellate ganglion block. I'm not going to get to. I just want you to understand what triggers. Little triggers are basically triggers through our 5 senses. They're significant. We're seeing something, we're smelling something, so on and so forth. And it brings back the trauma and the reactions of trauma as if it's happening in real time. So that's significant. The part that I want you to understand, there's also symbolic triggers. Symbolic triggers is something going on in the moment that mentally and emotionally represent what happened during that time of the trauma. A quick example is somebody I worked with was sexually assaulted by a stranger. She was being very successful in life, a professional, so on and so forth, had an issue with the IRS, and they said they're going to send something to her in the mail. Suddenly, she couldn't even go to the mailbox to get mail. You know, kind of that complex trauma. In her mind, it was something bad's going to happen that she can't see coming. It just brought back that trauma right back into the here and now. So we want to understand that there are little triggers. That just means through our senses. And then there are symbolic triggers. That means something through our mind, or not through our mind, that something's going on mentally and emotionally that strongly represents the trauma experience itself or a number of traumas. I know I am out of time. I threw a ton of information at you. At the end of this, if you have any questions or would like more information, please feel free to email me. You're important to me. I want to make sure that I can get as much information to you as possible. So I really mean it. If you want to reach out, I'll help out in any way possible. Otherwise, I can't tell you how much I appreciate your participation in this. I hope you found this helpful. I wanted to give you a different understanding of trauma than what's often talked about with PTSD and trauma. It sounds like a lot of you already have some of the background of this, if not all the background to this. So that's actually super cool as well. Stellate ganglion block is just an incredibly effective treatment that works with moving the stellate ganglion nerve back to a pre-trauma state. And it's very successful, but you also have to continue to do healthy things like maybe talk to a therapist, friends, engage in healthy activities. So that's everything. I want to make sure, Amy, any last comments or questions?
So there was someone asking about a link to the GABA study.
It should be on the slide.
And then someone had mentioned that they'd had the stellate ganglion block done and it dropped their PTSD score by 25 points. So that's really awesome feedback.
It is awesome feedback. Initially, the first 3 months, there's research that show as high as 85% do. So when you go to the slide, you'll see underneath where it's noted from. Just go to those things and that will help give you, there's a whole bunch of different research. A lot's being done through the VA on the stellate ganglion block. The issue is accessing the resource itself. It's not totally expensive. Like right now, like I think West Seattle Clinic does the full one for $900. But you can get all that information there. Let's see. So I think that's everything. Any other questions?
There's some people that would like the PowerPoint mailed. So I'm not sure, Fred, if you're on, maybe is there a list of people we can just send the PowerPoint to?
You're welcome to the PowerPoint.
I will see if I can email it individually. Or there might just be a whole group, but we'll figure it out.
Awesome.
Grace put in the chat that she could email it. Just send her an email to wellness@dva.wa.gov to ask for the PowerPoint and she'll send it to you.
Awesome. Thank you guys very much. I know we're out of time. Can't tell you how much I appreciate your participation. And if there's anything I can help in the future, please let me know. And take good care of yourselves.
Thank you. Awesome lunch, guys.
Thank you.